everyone, my name is Gabrielle and I'm a representative from Heritage Sierra Medical Group. Today you're in for a treat because we're going to be covering everything you need to know about Medicare, healthcare coverage, and how to save money. This is a very special segment with us and we have a very special guest, Jason Vallejos. Jason is a licensed agent serving Syndicated Insurance Agency, and he's here with us today to give us the tips and tricks on saving money on your healthcare coverage, Medicare, and accessing the most benefits with Social Security. Thank you so much for joining us, Jason. It's a pleasure to have you.
Thank you for having me. So folks out there, my name is Jason Vallejos. I'm with Syndicated Insurance Agency. I'm the Executive Vice President of an agency that's dedicated to helping people out there about anything that has to do with Medicare insurance. Feel free to give us a call. We're here to help you today. Thank you.
Thank you. And one thing that I really want to emphasize here is that Jason is hands-on. He's going to be with his team to guide you step by step. So if you have any questions relating to what we cover today, please don't hesitate to give Jason a call. One thing that I wanted to cover was, what is PPO? What is HMO? All the time people ask us, I have this healthcare and coverage, and you kind of see them shuffling through their bag to understand what it is that they have. Walk me through that a little bit.
Absolutely, folks out there. We're going to go through the basics. A PPO plan is a preferred provider option where you have the luxury of going to any doctor you want, but that comes with a cost. You have to pay higher copays, higher premiums, but sometimes you can get a lot more coverage, richer benefits by considering an HMO coverage, where you get sometimes zero copays, much lower premiums, or even no premiums on Medicare Advantage plans. So it's good to understand the difference between PPO and HMO because that could save you a lot of money out there.
That's good to know. Did you everybody catch that? If not, those tuning in, make sure you have a pen and paper at home because that's a big deal. A lot of times people are looking at their health insurance coverage and they see the HMO and they see the PPO and all they see is price tags. So Jason, tell me a little bit about some of those benefits and what you're getting with each option.
Yeah, so both of the options give you a lot of the same benefits where you get coverage in case of an emergency, if you need surgery, if you need prescriptions, if you need transportation. They follow a lot of similarity. The difference is what you're going to pay for. So if you are someone who relies on a primary care physician to send you to a specialist, you could save a lot of money with an HMO. It can reduce costs. You still get prescription coverage. You also get worldwide coverage, transportation, a lot of the similar benefits. It all comes down to the cost. On a PPO, you may have the same option. You can go to any physician you like, but that comes at a price and usually at high percentages of co-payments and an additional premium. So it all comes down to your lifestyle. If you want to consider what those options are for you, you need someone like us to talk one-on-one with you and find out what your needs are.
Oh my goodness, I don't think folks at home caught that. Let me repeat it just in case because that's a big deal. So you're telling me that if I have a PPO right now for my healthcare coverage, I could check to see if the same network of doctors is available in an HMO and save money?
Absolutely.
Wow, my goodness.
Yeah, it comes down to your lifestyle and how important your providers are. So if we can sit down, look over who your doctors are, find out what prescriptions you're taking, we can show you a comparison between a PPO and an HMO and how much you can save. So give us a call today.
You know, one thing that comes up, and I hear about this with our patients all the time, a lot of seniors or those 65 plus are managing chronic conditions and have a commitment to their medications. Tell me, are medications affected if you opt into an HMO versus a PPO, or how does that work?
A lot of times with an HMO, you could even have a more extensive formulary where even there are plans that are specifically for chronic conditions, for people with diabetes or heart conditions. You can actually save money on an HMO plan, a Medicare Advantage plan that can actually cater to those specific medications that you're taking. And you'll be surprised how much the savings can be.
This is how you know you're talking to an expert. He's using all the right terminology, and just in case you missed it, I want to make sure we go over this in detail. Jason, what is a formulary?
So formulary is a guide that gives insurance companies which prescriptions are allowed and covered under that plan. and then it tells you what the premiums are when you use those prescriptions. So a lot of times if you stay with generic medications, you can see a lot of savings. If for some reason you have to use brand name, you need to look at that formulary. We actually do those comparisons for you. We find out what those medications are that you're taking, how important they are to you, and tell you what the difference in cost would be among all the different plans that are available.
Wow. That's great. And if someone wanted to follow up and, just review some of the changes, maybe they're aging in, they need to enroll in Medicare, and there's a time-sensitive commitment. I know that the enrollment season is right around the corner. They can call you, right?
Absolutely. You can give us a call, find out what you currently have compared to other options, and we just take one call at a time. So if you have specific needs, we'll find out what those needs are, what your lifestyle is. If you like over-the-counter vitamins, those are benefits also that are covered. If you need assistance with transportation, if you travel and you're looking for worldwide coverage, we look at all those different options. It's all about you and catering to the services that are important to you.
Oh my goodness, that's fabulous. And is there a cost?
The service with us is absolutely free and with no obligation.
Oh, wow. So it doesn't make sense. If you're not calling Syndicated Insurance Agency and at least getting that complimentary review, I don't know what you're doing. It's a missed opportunity, because then we can compare those prescription costs, the health insurance cost, and those benefits. I mean, you said them quickly, but can you repeat them again for me? Because a lot of times people just take out that ID card and they forget what's actually covered with their insurance. So walk me through that one more time.
Yeah, so Medicare Advantage plans cover a lot of times the dental, the vision, transportation to and from your doctor's office, worldwide coverage, emergency coverage anywhere, ambulance, a number of benefits, vitamins, over-the-counter vitamins, even cotton balls are covered. Assistance with food if you're having those type of things. And for some folks, if you need assistance with your Part B benefits, there are plans that actually give you some assistance with that Part B premium that you're paying to Social Security. So we can even talk about those options as well. And of course, if you're having chronic conditions like diabetes or a heart condition, we could look at catering to your needs, where there's better monitoring of your sugar or blood pressure to make sure that you keep healthy and independent. So we really look at everything that you need.
Comprehensive. What more could you want, especially if it's complimentary? Thank you, Jason, for being with us today. If anybody has any questions relating to their Medicare coverage, wants to learn more, or wants to follow up to see what's available to them, please don't hesitate to call my special guest and licensed agent, Jason Vallejos. Thank you so much for being with us today.
Thank you for being with us. I really appreciate it. And again, give us a call. We're here to assist with any questions you have. You are important, you're an individual, and we want to know what your needs are and make sure you're taken care of.
Thank you.